In Part 3 of Module 11 on entitlements, we'll discuss entitlements and sustainability. As a percentage of total cost, state and local health and public assistance programs consume a substantial portion of state and local government budgets. Critics of social spending argue that if existing health entitlement programs are left unchanged, they will consume an ever-growing portion of state and local budgets, thus limiting the ability of government to allocate resources for other important needs. One solution proposed by critics is to thoroughly reform the current public assistance and healthcare entitlement programs, to judiciously trim costs where possible, and to adopt best practices and innovative programs to more effectively target health and public assistance funds. Another approach to reform in this area is the promotion of investments in the prevention of illness and early screening and diagnosis, hence cost containment via citizen wellness practices and early treatment of preventable illnesses. In the 1990s, state and local governments across the country took the lead in reforming existing public assistance programs and placing limits on welfare eligibility and promoting active re-engagement in the workforce for many recipients. The result was a precipitous decline in the number of welfare recipients in nearly all states. From the perspective of the former welfare recipients, many of them benefited from welfare-to-work programs. However, simply getting individuals off welfare rolls and into the workforce is not the end of the sustainability story when it comes to entitlements. Welfare-to-work programs are social programs instituted in 2004 seeking to encourage those on public assistance to return to work rather than depend on income support. One of the biggest issues facing former public assistance recipients beyond employment is the difficulty of maintaining and improving existence, for example, balancing new employment with the need for quality child care. The stresses and strains of life off the welfare rolls after years of dependence often prove to be too much all at once, and the ability to deal with these pressures come at a time when the costs of services are rising and the range of family needs, for example, access to cable, TV, and the internet, is growing. One of the areas of entitlement that was almost immediately affected by welfare entitlement reform falls under the healthcare policy arena. The meteoric rise of expenditures for healthcare entitlement programs such as Medicaid and S-CHIP, for instance, are frequently bewildering to the average citizen. Medicaid is the national, state, cooperative healthcare plan designed to serve the medical service needs of low-income individuals and families. And the State Children's Insurance Program, or S-CHIP, is a state program cooperatively managed at the state and federal level intended to meet the health care needs of uninsured middle and low-income children. In the U.S., health care policy has been tied closely to issues of defense, economics, urban planning, immigration, age, class, race and ethnicity, and a whole host of other issues. National programs in health care began as early as the 18th century with the Marine Hospital Service. Community-level health care initiatives were primarily privately managed until the late 19th century, when large-scale immigration resulted in rapid urbanization. Major epidemics such as the cholera outbreak in New York City led to the widespread creation of public programs for sanitation and health care in state and local governments across the entire country. As our societies continue to urbanize, the need for such programs has increased tremendously. Healthcare has progressively come to be viewed as a benefit not only to the individual receiving healthcare services, but also to the community. Healthy people provide a good workforce. They spend more time in productive activity than under medical care, and they occasion less need for collective resources to be devoted to healthcare services for the indigent or poor. In sustainable economies of the future, all elements of production must be able to work in unison. Healthy workers are a critically important part of the economic enterprise. As a society, we commit a tremendous amount of money and time educating and caring for young people. Proper investment in the future, after all, is a critical dimension of sustainability. Children who are not healthy are unable to benefit from education and will likely develop other physical ailments that adversely affect their social and economic potential. Problems such as birth defects and autism can be treated if diagnosed early, and those conditions can be medically managed far better today than was the case in the past. As the baby boomer generation ages, an increasing proportion of our governmental resources will necessarily be spent on medical needs. A sustainable community facing this known pending demand on its resources must be both compassionate and pragmatic. The demonstration of governmental compassion for the elderly and infirm is very important to building inclusivity within society and to promoting social justice. Pragmatically, a sustainable community is aware of the great benefit of maintaining a healthy and productive population. Older, richly experienced individuals often bring with them economic resources, for example, skills, social networks, accumulated wealth, and so forth, that can help local economies and generate employment. Older individuals often bring substantial intellectual capital gained from years of experience in the workforce through the employment of these retirees in new professions. This intellectual capital can be tapped to improve society. Disabled individuals often possess many valuable skills and knowledge that are frequently lost to society and to the individual when physical limitation separates them from the larger community. While many of these individuals receive some level of federal health care benefits, there are a substantial number of disabled individuals who, in midlife or early older age years, would remain inaccessible if it were not for state and local government health resource entitlements. Health care for the elderly, therefore, is critical to improving community sustainability. The very meaning of the word healthy has changed substantially. One could have perfect physical health, for example, normal blood pressure, cholesterol, heart rate, and eyesight, but suffer from severe mental health maladies. Health issues related to depression, bipolarism, and personality disorders have long existed in society. However, in the past, individuals have had little or no access to healthcare solutions for the problems of mental illness. What solutions did exist often involved institutionalizing individuals in sanitariums rather than helping them to remain within the general community and achieve a productive and respected role in society. Addressing the problems of mental health has become an increasingly important matter for state and local governments in the United States, as the size of the population affected and the problems arising from mental illness in society have become more evident. The stresses of the school setting, high-stakes testing associated with the No Child Left Behind policy, the workplace, and living in general under the conditions of the threat of terrorist attack and prospects of global climate change have become overwhelming for many individuals and the families within which they live. No Child Left Behind is a federal educational act created to improve the performance of schools using standard-based reform to measure goal attainment in primary and secondary public schools. Work schedules have become extended with the advent of computers and advances in communication technology, changing the boundaries that once separated office and home settings. The itinerant nature of contemporary society and the high technology world tend to separate people from one another rather than bringing them together. Health care issues then clearly extend to problems previously known, such as mental health, but all too frequently ignored as a matter of governmental concern. As a final example, the issue of substance abuse is a growing public health concern. In the past, substance abuse was assumed to be the rational choice of individuals. Addiction and possible death as a result were viewed as the price paid for a bad personal choice. A sustainable community, however, cannot rationally make the choice to simply ignore problems associated with substance abuse and drug addiction. Philosophically, societies agree to care for their members. Practically speaking, it is a serious strain on society to simply let the forces of drug addiction and substance abuse sap the strength of the community and substance abuse problems across age, gender, and ethnicity boundaries. In Part 4 of Module 11 on entitlements, we'll discuss public assistance.